Do you know what meningitis is? It's a serious, potentially life-threatening infection that affects the meninges, those protective membranes that lovingly swaddle our brain and spinal cord. Like the bodyguards of our central nervous system, the meninges work hard to keep us safe, but sometimes they come under attack, and that's where meningitis rears its head. Now, why is understanding meningitis so crucial? Well, it's because this disease doesn't discriminate. It can affect anyone at any age, and its symptoms often mimic that of a common flu, making it hard to detect early. The severity of meningitis and its potential to cause long-term complications, even death, underscores the importance of recognizing and treating it promptly. So, we've scratched the surface on what meningitis is. A sinister infection that targets our brain's protectors and can have serious consequences if not treated swiftly. Now that we've established what meningitis is, let's delve into the causes. You might wonder, what causes meningitis? Well, meningitis can be triggered by various types of infections, most commonly by bacteria, viruses, and in some cases, fungi. Each of these infections has a unique way of attacking the body, but they all ultimately target the meninges, the protective membranes covering the brain and spinal cord. Bacterial meningitis, which is typically more severe, is often caused by bacteria such as Streptococcus pneumoniae and Neisseria meningitidis. These bacteria can enter the bloodstream and travel to the brain and spinal cord. Alternatively, they can invade the meninges directly, following an ear or sinus infection or a skull fracture. On the other hand, viral meningitis, often less severe than its bacterial counterpart, is primarily caused by enteroviruses, which are commonly found in the human intestinal tract. These viruses usually spread from person to person, particularly during late summer and early fall. Fungal meningitis is quite rare and usually affects individuals with weakened immune systems. Fungi like Cryptococcus and Histoplasma, found in soil and bird droppings, are often the culprits. Understanding how these infections spread is crucial. Close contact, such as kissing, sneezing, or coughing, can transmit the bacteria or virus from one person to another. Sharing personal items like toothbrushes or eating utensils can also lead to transmission. Certain medical conditions, like a compromised immune system, can make an individual more susceptible to these infections. But it's not just about close contact or having a weakened immune system. Certain age groups, particularly infants, are at a higher risk. Even lifestyle factors, such as living in close quarters like dormitories or military barracks, can increase the risk of contracting meningitis. So, whether it's a bacteria, a virus, or a fungus, the causes of meningitis are as diverse as they are dangerous. Each one poses its own set of threats, and understanding these can be the key to prevention. But remember, it's not just about understanding the causes. Understanding the causes helps in prevention, but recognizing the symptoms is equally important. So how can you tell if someone might have meningitis? It's a question that could potentially save a life. Meningitis is a serious condition, and understanding its symptoms is the first step towards timely intervention. First, let's talk about fever. It's one of the most common symptoms of meningitis. However, it's not just any ordinary fever. It's usually high and persistent, often accompanied by chills. This fever isn't the kind that comes and goes. It sticks around, and it's stubborn. Next up, we have headaches. Now, we've all had our fair share of headaches, but the headache associated with meningitis isn't your typical tension headache. It's severe and unrelenting, often described as the worst headache of one's life. And it's not eased by over-the-counter painkillers. It's a headache that makes you stop and take notice. Then we have to mention the stiff neck. This isn't just a slight discomfort or tension in the neck. It's a serious stiffness that makes it hard to touch the chin to the chest. This symptom alone can be a significant clue pointing towards meningitis. Sensitivity to light, or photophobia, is another hallmark symptom. Bright lights are uncomfortable and can exacerbate the headache. It's as if the world has suddenly become too bright, too glaring. Finally, there's confusion. Individuals with meningitis might appear disoriented, have difficulty focusing, or even experience hallucinations. This isn't just simple forgetfulness. It's a sign that the infection is affecting the brain and requires immediate attention. These symptoms don't always appear all at once, and they can develop over several hours or even a few days. But whenever they do appear, it's crucial to seek immediate medical attention. Time is of the essence when dealing with meningitis, and every second truly counts. Recognizing these symptoms can save lives, but what happens after a diagnosis? We'll delve into that in the next segment. For now, remember, fever, headache, stiff neck, sensitivity to light, and confusion. These are the alarm bells of meningitis. Be alert, be aware, and above all, be ready to take action. Meningitis is a serious condition, but there are treatments available. While it's a statement that might initially trigger anxiety, it's also a beacon of hope. Knowing that something can be done to combat this disease is a comfort to many. The treatment for meningitis largely depends on its cause. Bacterial meningitis, which is the most severe form, often requires prompt treatment with intravenous antibiotics and, in some cases, corticosteroids. This helps to ensure the bacteria is eliminated and inflammation is reduced. It's crucial to start these treatments as soon as possible to prevent complications such as brain damage or hearing loss. For viral meningitis, which is more common and usually less severe, antibiotics are not effective. Instead, most people with mild symptoms of viral meningitis recover on their own within 2 weeks. In these cases, doctors often recommend plenty of rest, hydration, and over-the-counter pain relievers to help with symptoms. Fungal meningitis is rare and usually only affects people with weakened immune systems. Antifungal medications are used to treat it, but these can have serious side effects, so treatment will typically be managed by a specialist in infectious diseases. Parasitic meningitis, another rare form, is usually treated with a combination of medications that kill the parasites and reduce inflammation. Now, let's consider prevention. Vaccines can protect against some forms of bacteria and viruses that can cause meningitis. These include vaccines for meningococcus, pneumococcus, and Haemophilus influenzae type B. It's important to remember that while these vaccines have significantly reduced the rates of meningitis, they do not prevent all cases. Other preventive measures include good hygiene practices, such as washing hands regularly and avoiding close contact with sick individuals. In conclusion, while meningitis can be a severe and frightening condition, there are a range of treatments available depending on the cause. Early diagnosis and prompt treatment are key, and vaccines play a crucial role in preventing some forms of the disease. Timely treatment can significantly improve the outcome of this serious condition. We've covered a lot about meningitis today. Let's take a moment to recap the key takeaways. Meningitis, as we learned, is an inflammation of the protective membranes covering the brain and spinal cord. It's a serious condition, often caused by a bacterial or viral infection, but it can also stem from other sources like fungal infections or certain medications. We discussed how symptoms can range from fever, headache, and stiff neck to more severe signs like seizures or altered consciousness. Remember, early detection is crucial as meningitis can progress quickly, and in severe cases, it can lead to complications like brain damage or even death. We also explored various treatment options. Bacterial meningitis requires immediate antibiotic treatment, while viral meningitis often resolves on its own with rest and supportive care. The journey of understanding meningitis doesn't end here. It's essential to stay aware, stay informed, and reach out to healthcare professionals when in doubt. Remember, knowledge is power when it comes to health. Stay informed, stay healthy.